So what you want to do is you want to bisect the lower third of the leg. Okay. And again, not the middle of the skin and the flesh. You have to push in to feel the bone and then go right to the middle of the bones. So that's the middle. That looks like the middle. That looks like the middle. I'm going to do one more. There looks like the middle. Okay. So that's her bisected lower third of the leg. Okay. And then you do the same for the calcaneus. And your foot can just be hanging out here. You just have to find the calcaneus, find the medial sort of wall of it and the lateral wall. Okay, and then you're going to bisect it straight down the back of the calcaneus, right? There it is, straight down the back. Close. You kind of close one eye and lean over and look. Then you put her in subtalar neutral. Okay, so you palpate lobster pincher grip, right? Medial and lateral aspect of the head of the talus, and then by grasping the metatarsals, you're going to alternately supinate and pronate her. When you supinate her, you feel the lateral talus bulging out into your index finger. When you pronate her, you feel the medial side of the talus bulging out into your thumb. So what you do is you go back and forth until you find subtalar neutral. All right, where you feel neither head bulging one way or the other. Your subtalar neutral is right there. Now, Sandeep, I want you to hold that right there. Do not move. Maintain that position. And then what I would do is I would take, can you grab me that pen, Mecca? Yeah, that's good. I would just take a goniometer now and put the axis of the goniometer right here, right at the top of the calcaneus, and I would measure this angle. And you can see that the two lines are not in a straight line. They're at a little bit of an angle this way. That's rear foot varus, right? That would be rear foot varus probably of 5 degrees or so. If I had her in subtalar neutral and this line was actually going out this way, I would measure the angle and that would be rear foot valgus, relationship to the leg. But more commonly, what's normal is a mild amount of rear foot, 8 to 13, what is the normal? I have to check the notes. Let me check the notes.
Okay.
About the normal amount of varus. Okay? And then the other thing is to do forefoot to rear foot. Now you ignore this line completely. And what you do again is you grasp all of her metatarsals with like this, like a lumbrical grip, and you find the talus and you get her in subtalar neutral. Now with her in subtalar neutral, which is right about there, now you look at the metatarsal heads relative to this line. They normally should be perpendicular, right? So here's the calcaneus, here's our metatarsal heads. Is it perpendicular or is it varus? With her in subtalar neutral, are her metatarsal heads all tilted in this varus way, right? Or are they all tilted in a valgus way, which is much more uncommon. Now remember, the most common thing to happen is if someone has either rear foot varus or forefoot varus, right? Let's say she has both. She has, with her in subtalar neutral, if she stood up on the ground now, all of her weight would be on the lateral border of her foot. So what's the natural compensation going to be in order to get her foot down to the ground?
Pronate.
Right, she's going to pronate. Pronate is what most people will do as a compensation for either a rear foot varus or a forefoot varus deformity, because otherwise they're going to be walking with this medial side of their foot up in the air. Not going to be, and some people do. Some people will walk on the lateral borders of their foot uncompensated rear foot varus, uncompensated forefoot varus. For forefoot, she could either pronate or she could plantar flex her first ray, or some combination thereof. Okay? Mm-hmm. All right. What other special tests? Let me think.